Well, do you have a high blood pressure or maybe heart failure? Then it might be that your doctor prescribed you Losartan, also known as Cozaar. In this video we will cover how and when to use it, what side effects it can cause, what dosage you need and much more. So make sure to watch the whole video so you don't miss any important information. For those of you meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and it's my mission to medically educate you, my viewer, because educated people make healthier decisions. So let's get learning. As mentioned, the generic name of this medication is Losartan and is available under the brand name Cozaar as a tablet. If you want to use it as a tablet, just swallow it whole with half a glass of water, and it's best to do so at a fixed time. This will make you less likely to forget to take your dose. Furthermore, if you experience dizziness as a side effect, then you could best take it in the evening before going to bed. Now, Losartan is part of a group of drugs called ARBs, Angiotensin receptor blockers. As a result of this effect, this drug causes a dilatation in your blood vessels and reduces aldosterone secretion. This causes a drop in your blood volume as well as a drop in your blood pressure. Therefore, Losartan can be used to treat a very high blood pressure, heart failure and certain kidney problems. Which brings us to the correct dosages to use. And here I want to mention that it can only provide you with some useful guidelines. Always use the prescribed amount and frequency your doctor gave you, as your specific dose might depend on your indication of use, severity of your symptoms and the side effects you might experience. However, when treating a high blood pressure in adults, most doctors will start with an initial dose of 50 mg once per day, which if necessary can be increased up to a maximum dose of 100 mg once per day. When treating heart failure, the initial dose is 12.5 mg once per day, which if needed can be built up to a maximum dose of 150 mg once per day. Losartan can be a very effective drug, but unfortunately it can also cause some side effects. I will discuss some of the most common ones in this video, but if you're looking for a complete list, then check your leaflet, ask your doctor or your pharmacist. Commonly it might cause a low blood pressure, dizziness or fatigue. Uncommonly it can cause palpitations, chest pain, edema, nauseousness and vomiting. And rarely it can cause various serious other side effects. Which brings us to the safety of use. First of all, it's safe to drive when using this drug. However, when you feel dizzy or fatigued, then please be careful. Secondly, when using alcohol, also be careful, as alcohol widens the blood vessels and therefore can increase the side effects of dizziness and fatigue, especially at the beginning of your treatment. Losartan could also have interactions with other drugs you're taking, so always discuss this with your personal doctor. And lastly, Losartan can be dangerous for women which are pregnant or breastfeeding. Also discuss this with your personal doctor. Now I hope you know now how to use Losartan, but if you have any questions, let me know in the comment section and I will do my best to answer each and every one of them. Furthermore, I also made a playlist with more useful medical videos. You can find it in the description. If you did like the video, if you did learn something, please click the like and subscribe button. This will help out the channel tremendously, and in return you will get a notification of a weekly update, a weekly medical video. Furthermore, if you can't get enough, check out the Instagram as well, @howtomedicate. I'm posting there regular updates. And otherwise, I will see you next week with a new video. Bye bye.